Welcome to Aesthetic TV and our Aesthetic Transformation Room, where we'll be bringing you live treatment demonstrations featuring new technologies performed on viewers just like you. And today, with the help of my patient Peggy, I'll be introducing you to a new procedure called the Laser 360 from Alma Lasers. This highly versatile device combines multiple technologies to treat the most common symptoms of premature aging.
So let me ask you something, Dr. Ordon, just quickly. What are some common symptoms of premature aging?
Well, that's a great question. And as we age, we all start to get, number one, a few of the fine lines, the wrinkles. Number two, we get brown spots, which are a result of being in the sun too much, as well as just the normal process of aging. So why don't we ask Peggy? Peggy, what bothers you about your face?
All those things you just mentioned.
All of the above?
Yes, I particularly don't like these brown spots here on my forehead.
So Brenda, you see that? Those are typically age spots. You can also call it, we have big fancy names, dyschromias, you can call that. And Peggy does have some fine lines you can see here in the crow's feet and a little bit of crepiness on those lower eyelids. And finally, she does have some broken blood vessels here. And the great thing about this, the 360 laser, it's going to take care of all of those problems.
Fabulous.
Pretty cool, huh?
Yeah.
So, as I was saying, the Laser 360 uses 3 technologies to provide the most comprehensive skin rejuvenation available. Really, it's 3 treatments in one. Number 1, the AFT Intense Pulse Light evens out skin tone, reduces tiny broken blood vessels and other color irregularities often caused by sun damage,
which is what we
I just showed you
on
Peggy, but we're not done yet. Next is the NearInfrared, and what it does, it's heating the inner tissues to increase blood supply to help regain a youthful, contoured appearance.
Okay, well, before you get to number 3, I wanted to ask you a question. This laser is just a face laser, or let's say I had some pigmentation or discoloration on my arm or my leg. Could it be used for other parts of my body, or is this specifically for your face?
No, you can use it for other parts of the body as well. As you know, your skin is a little bit different.
Right, I was thinking your skin is more
different
sensitive,
thickness, susceptible to different types of changes. But yes, by adjusting the settings in a proper way, you virtually can treat most areas.
Okay, great. Good to know.
And then finally, the third component, we have Pixel, which Pixel creates thousands of microscopic perforations stimulating new collagen growth. This improves the skin's texture and tone to smooth out fine lines and wrinkles, and the skin around each perforation remains intact, which allows the surface to heal more rapidly and without any scarring. So, in general terms, I know these are things that you want to know and you viewers want to know. Each treatment takes about 30 minutes. The great thing about Laser 360, it's designed to be customized to your skin's condition, so the exact treatment may vary. For Peggy, she has certain issues, she's a certain age, she has a certain skin type, so we're going to adjust our settings on the Laser 360.
Right, because that's what I was wondering, because different skin types, ages, colors, it's good for any type of skin.
We have different skin classifications, and we have specific guidelines to follow for each different skin type. But you're asking some good questions.
Thank you.
All right, so this provides great results in improving a number of things, as we mentioned: skin color, wrinkles, tone, and texture. You know, patients typically experience results within 5 days, Peggy.
Wow, that's
but
really good.
The real results you don't see for up to 30 days, because your body is working inside. It's repairing itself. It's healing. New blood supply is forming. And finally, we're forming new collagen.
So how I looked at it is, Peggy, you get to sit here and get one treatment, but literally every day for 30 days, your treatment is working and activating, and it's like getting a treatment every day for 30 days. I find that fantastic.
Well, that's what the technology is doing now. These non-invasive treatments, it's really just putting heat, light to your skin, to your dermis, to the deeper tissues, which stimulates new growth and that takes time to do. So
Well-
you sort of kickstart your body.
Right.
Your body does it on its own.
Okay, so it looks like with all that information you've given us, we are ready to begin
It's
treatment.
time to start that
That's
treatment.
Right.
So a
Are
couple
you
things-
ready? Are you ready?
Yeah, most
Okay.
importantly,
Okay, Peggy.
I know you're ready.
I'm ready.
I'm ready, but Peggy, are you ready?
I'm ready.
Okay, and before bringing Peggy in, a couple things we did.
Okay.
We made sure to really clean her face
Okay,
well,
right.
clean everything, remove all the makeup,
Right.
get those pores as clean as possible. Next thing, we did apply a topical anesthetic agent
Okay.
that we let sit for a few minutes, and
It's a numbing cream, right?
it's a
It
numbing
just-
cream,
it just
yeah, like you get
numbs.
for waxing or electrolysis or something like that. Similar type thing, which I think is going to make the procedure
Right.
pretty comfortable for Peggy.
Is it kind of like what they do on the Q-tip?
For the dentist?
Yeah, when they rub your gums.
similar
Yeah,
to that.
same, yeah.
But this is for the skin.
Yeah.
So
So we're going to pass out the goggles, right?
We are going to
Because
do
we
that.
gotta put our goggles
let me,
on.
Let me fire up our laser 360, and
Okay.
it does make a little bit of noise.
Okay. Let's see. Maybe a little bit, not too much.
Here
oh, it's
it
firing
goes.
up.
Yeah.
Ooh, it's like an engine
It's getting all
taking off, a
it's
plane
get-
going.
It's getting all fired up.
But it's all good.
All
We're going
right.
to see great results. All right, so I'm going to pass the goggles
Right,
out.
for-
You get these.
For all laser treatments,
Beautiful ones. You wanna put them on, or you
eye
want me to?
protection is very, very important.
Yes. I like those. Let me see. Put these on. You put them on. Let me see what they
You
look
can
like.
have those, Brenda.
You sure?
Yes.
All right, thank you. And the goggles are to protect your eyes from the laser.
Correct.
Okay, very good. You ever done anything like
Gloves.
this before?
Oh, no, not really. No.
Okay, so this is the
I
first
thought
time.
I thought you were asking me.
Yeah.
He is a
Yes,
real doctor.
yes,
Don't
I-
worry.
Good to
Yes,
know.
You're going to be okay.
I have done this before. All right, stand by. We are
Okay,
now
here we
in
go.
the charge mode.
All
So
right.
what you are going to see some bright lights, and I'm going to do one just so you know what to expect. Okay, it's going to be a little flash like
Okay.
that.
Okay.
Correct. And each time I do this, you may just feel a slight little pinch, like a rubber band snapping on your face. Are you okay?
Are you
I
okay?
don't even feel that.
You don't even feel it. That's great. So you're not uncomfortable. You're
Well,
not in pain.
I guess that numbing cream
That's great.
is working pretty well.
Wow. Well, that's great. So you're still okay, right? You're not hurting?
Yeah, so far, so good.
Good. She's even able to talk during the treatment. That's good. You're not clenching your fists, so we know you're relaxed. Don't move. Keep your head very still. There you go.
Important to get a nice, complete coverage of the areas that you want to treat.
Okay.
You do a slight overlap here.
Does it matter the way you hold the laser or the angle
Well,
that you do?
I don't want to tilt it. I want to
Okay.
make sure that I have nice, smooth, even contact
Okay.
to these areas. So you see in different
Right.
anatomic sites, I shift the handpiece
Okay.
so that we have nice contact.
Plus the way the structure of the bones in the face are, you have to probably move it around.
It's
to get
every
in.
little bit different,
Right,
yes, and
right.
I do want it where she has these fine lines
Right.
on the upper lip. Very important that I get
Okay.
that for her, so I want to do that right now.
And how close to the eyelid can you get? Like how close under the eye?
Quite close. I'm going to move
Right, because
this
I
up.
see these goggles here. Okay, you can get really right up there, and it's not harming that skin. It's actually rejuvenating it. And
I
it's gonna-
love doing these crow's feet.
Wow.
'Cause
You
I-
are right in there. I don't
because
know
I-
if you guys can see that. He is right in there. That is amazing.
And I may actually do a couple extra passes on those crow's feet
Okay.
to eliminate those wrinkles. So
Does-
go ahead.
Does it matter how many times you do it, or how many passes, or?
Well, you can vary depending on the skin type, how
Okay.
deep the wrinkles
Oh,
are,
okay.
and your settings.
Settings,
All
okay.
of those things can be varied
Or factors, okay.
depending on the patient, as we said that.
Okay.
This treatment is specifically designed for everybody's patient. So
Okay.
we've treated this side, we're going to treat the other side,
Okay.
then we're going to go on to the next part of the treatment.
How do you feel, Peggy?
Good.
She's okay, right? You feel good?
Yeah.
Wave. You okay?
Very
Thumbs
good.
up. Okay, good.
Bear
Just
with
finished
us.
the first treatment,
we
right?
finished the first phase of the 540.
right.
So it's time to move on to the second phase, which is the NIR.
And what is that?
Near infrared. Again, that specifically refers to a wavelength of light. And what is the main thing that this is going to do? It's heating up those deeper tissues of the skin.
Okay.
We're getting into the dermis. What does that heat do? Well, it stimulates collagen growth, a realignment of the elastin fibers.
Okay, don't forget your glasses.
What that means to you, Peggy, is that means fewer lines and tightening of your skin.
So this is the second part of the treatment.
Phase
that we're
2.
doing. Phase 2. All right, how you doing, Peggy? Okay?
I'm doing well.
You ready for phase 2?
I
And
am.
what's so
Okay.
cool, this machine does all 3 of these. Now, this handpiece, you're going to see that it's a little bit of
It's different.
It's a different.
It's a completely
it's a
different
different
handpiece.
action, and you saw that I was steady
Right.
on the last treatment. On this one, there's
Right.
a little bit of rotation movement because
Oh.
you don't want that heat going all in one place at the same time. You want
Okay.
you want to distribute that. Okay.
Oh, I see. Oh, wow.
So you see this?
And you're actually just touching the skin, moving
Yes.
around. How are you feeling, Peggy? Okay?
Yes, I'm good.
Don't shake your head. Just slightly. I don't want you to move too much.
Do you feel any heat there?
A little bit, yes.
Yep.
But not anything uncomfortable. Nothing's
No.
uncomfortable. Nothing at all.
Well,
That's good to know.
You're supposed to heat, and you know, I try to do this little bit of contouring as I'm moving this handpiece.
You're holding the skin.
I'm trying to do a little face jowl lift here
Okay.
as I'm moving this tissue
And so you're
up.
concentrating here and you're tightening these areas here where we tend to sag, right? Is that what you're doing?
Exactly.
Right.
Really, I'm going to do the whole face, of course.
Right.
But at this point, I'm focusing
Right.
on the mid face, the jowls, and that jawline.
Great.
So we're ready to move on to the third phase, the
Okay.
eye pixel, which is actually a fractionated erbium laser. It's an ablative laser, which means we're actually ablating that outer layer of skin.
What does ablating mean?
Well, you see how nothing has changed on the epidermis?
Right.
This is penetrating deeper.
Oh.
Ablative, that we're actually removing some of the outer part of the outermost.
Is that dead already because of
Well, it's
what
going to
you've
be
done?
removed. Yes, you do have a dead layer of
Right,
skin. Some
okay.
of that will come off.
Okay.
But we're going a little deeper than that as well. As you've noticed, I removed the ultrasound gel for this
Right,
treatment.
that's right.
It's a little bit different. I've cleaned her face.
Wow. Okay. So
And
this is,
finally, it's a different, totally different. And
okay.
in this part, I need a little participation
Okay.
with you. You're my assistant,
Okay,
Brenda.
so glasses back
Because
on.
it's ablative, we're burning off some of that skin.
Okay, okay.
And you're going to see that
So
in
this
1 second.
this I'm holding is what?
That is just to, you're going to have a little bit of smoke. It's a smoke evacuator vacuum system.
Okay.
So as the skin smokes a little bit,
Okay.
and you're going to see me with these rollers, and what I do
Okay.
is that fractionated CO2.
You okay, Peggy?
Yes.
Okay, good. You're gonna look beautiful.
Great.
See, look at her smile. You're gonna look gorgeous. More gorgeous. Okay, so now what are we doing?
Do you see that?
Oh, wow. I see a little white. And you're moving very slow, right?
Very slowly,
Why?
because I want to cover all the areas. I don't want any skip lesions.
Now I hear stuff coming through this tube.
How do you like that? You see
That is
that?
amazing. Are you
So-
okay, Peggy?
Yep.
Okay.
So what we're going to do is we're going to continue on,
Okay.
and you see that?
I do.
That we're getting
Wow.
these micro little areas, but we're saving areas in between. That allows for quicker healing,
Right.
and she's not going to scar. But
That's
you see,
beautiful.
well, we're getting
So
there.
this is very, very different. The others were a more broad stroke, so to speak, and this is a much more
Very
concentrated,
slow.
slow.
Erbium laser resurfacing. This is what really gives that nice luster
Okay.
to your skin. Great for fine lines, but you're also going to get some tightening at the same time.
Okay. How you
So
feeling?
that gives you a little bit of an idea of what we want to do.
Okay, and then this is the third and final phase of this entire process. Is that right?
Yes.
Okay.
Each phase doing something a little bit different.
It's kind of like some of the other products we talked about earlier, the 3 phases. You're still doing
All right,
all right.
so you can see that we've treated this this mid-face area,
Yes.
and it's the combination of the three that is what's going to give Peggy the kind of result that she wants. So
Now this little white, there's small little white lines. What does that mean? What
those
is
are
that?
little micro burns in the skin.
Is that right?
So yes, so that's why it's called ablative. You want to see that. That means that the skin has been treated properly.
And when does that go away?
That's going to fall off in a matter of a couple days, a day or so.
Okay, okay.
Depending how deep you go. But that
Okay.
will flake off, and then she'll be left with nice smooth skin.
And then you're going to look even more fabulous.
So we're going to finish up the treatment with Peggy, and while we're doing that, I want you out there to take a look at some of the amazing before and after photos so we can all see what Peggy has to look forward to. So we've just finished up on Peggy's Laser 360 treatment. Now, Peggy, how do you feel?
I feel great.
Good.
Good. And as we told her, the best is yet to come.
That's right. You know what, I'm so amazed, just really quickly, how most lasers you would blister and see this horrible scarring. This is very subtle.
That's why you
Very
do the patient awake, and you can go deeper.
Yes.
You can sedate if you want,
Right.
but a lot of times
You don't need to.
patients don't want the downtime.
Right.
The Peggy really is, with the way we did it today,
Right.
Peggy is going to have minimal downtime. So, you know, she'll probably continue to feel warm in the treated areas over
Right.
the next 24 hours,
Okay.
something like that. Probably going to have a little bit of sensitivity and redness. That shouldn't last more than just a few days.
Can you work out after
want her
laser
to-
treatment?
I want her
Can you
to
just let your
let-
skin settle?
Give it a couple days
Okay.
before you work out. And
Okay.
you know, she can start noticing improvement with the tone of her skin, and we'll notice improvement of fine lines and wrinkles probably in a matter of a few days
Oh,
as this
great.
flaking comes off.
Right.
But it's going to take a little bit longer for the end result, 30 days or so,
Right.
maybe even a little longer while that body is healing up. You can expect the same from Laser 360. For more information on Laser 360 and other cutting-edge aesthetic treatments, please use our treatment finder at aesthetichtv.com. I'm Dr. Andrew Ordon for Aesthetic TV, where we help you look and feel your best.
That's right. And I'm Brenda Epperson. Thank you so much. And Peggy, you were great. Thank you so
Thank
much.
you.
You're a trooper.
Bye.